Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. Today we will discuss few multiple choice questions from anatomy and physiology of nose and paranasal sinuses with explanations of those answers. So let's start today's discussion. And before start, don't forget to subscribe the channel. And just to practice MCQs for any subject, good preparation means that just by reading the statement of the question, the answer should be there in your mind. And I will suggest to you that before going through this video, I have uploaded videos regarding anatomy and physiology of nose and paranasal sinuses. The links for those videos are there in the description box. So please check those videos before going through all these MCQs. One thing. Second, that when I show you the answer, before I explain the answer for that particular question, there will be some pause, and in that few seconds or minutes, you have to come up with your own answer. You can write it down on your notebook or just keep it in your mind so that you can assess yourselves. This is what it is, self-assessment. And this is also a method for preparation for any exams, for any subject, that because it is not a riddle, or you just don't have to learn the answers by heart. Because okay, sometimes it happens that questions from past books come just copy paste, and you may be successful, but for the depth of the knowledge or concept of the subject, it is essential that you must know the logic of the answer. So for self-assessment, always read only the statement, then make up your mind for a specific question answer, and then go for the options and see what is the answer and whether you have assessed it correctly or not. So frontonasal duct opens in. So whatever comes in your mind, write it down. The options we have got here are these different meatuses in the lateral nasal wall and different turbinates. So of course, frontonasal duct, it will opens into meatus, but which meatus? The meatus is middle meatus. Frontal sinus drains into, again, so answer is again the middle meatus. Now the question is the same, the first one and the second one. In first one, he has asked you, I just go back to the first one, frontonasal duct. So frontonasal duct is that duct which drains this frontal sinus into. So just by changing the words, question remains basically the same. So frontal sinus or frontonasal duct, it opens into the middle meatus. And by the way, middle meatus is the area in the lateral nasal wall which has got a ostiomeatal complex, and that is very important area as far as the pathology of the sinuses is concerned, and the treatment, specifically the functional endoscopic sinus surgery, which is abbreviated as FES, that is very important for ostiomeatal complex and middle meatus. So which of the paranasal sinuses not opening in middle meatus? So in lateral nasal wall, if you remember the anatomy of the middle meatus, 90% of the anatomy of the nose, you can cover it very well. As you can see, this is the third question, and still the question is related with the middle meatus. Now again, he is asking about us that which of the paranasal sinuses not opening in the middle meatus. So sphenoid sinus does not open into the middle meatus, because in the middle meatus, anterior group of paranasal sinuses open. From our anatomy knowledge, we know that paranasal sinuses, there are 4 pairs of paranasal sinuses on the right side and the left side, that is frontal, that is ethmoid, that is sphenoid, and that is maxillary. And they are again divided into 2 groups. One is called as anterior group of paranasal sinuses, the other one is called as posterior group of paranasal sinuses. And anterior group of paranasal sinuses include maxillary sinus, frontal sinus, anterior ethmoid, and middle ethmoid air cells if they are present. And this anterior group of paranasal sinuses, they open in middle meatus, while sphenoid sinus and posterior ethmoidal air cells, they are included in the posterior group of paranasal sinuses, and sphenoid sinus opens in what we call as sphenoethmoidal recess, which is above and posterior to the superior turbinate in the lateral nasal wall. And posterior ethmoidal air cells, they open in the superior meatus. So if we go for the options in this particular question, first 4 they are included in the anterior group of paranasal sinuses, so they open in the middle meatus. So what is left is sphenoid sinus. Sphenoid sinus is in the posterior group of paranasal sinuses and it opens in the sphenoethmoidal recess. So the answer for this particular question is sphenoid sinus. All drain into middle meatus except. So again, you can see this is the 4th question consecutively related with the middle meatus. So again, I am reiterating the importance of middle meatus. If you know the middle meatus properly, the anatomy of middle meatus, 90% of anatomy of the lateral nasal wall is being covered. So all drain into middle meatus except. So just look for the options: anterior ethmoidal, frontal sinus, maxillary sinus, middle ethmoid, all those are anterior group of paranasal sinuses, but lacrimal duct is not included into anterior group of paranasal sinuses. So the odd one here is lacrimal duct, and that is the answer. Rest of are the sinuses which are included in anterior group of paranasal sinuses, and as we just discussed, anterior group of paranasal sinuses are draining into the middle meatus, while this nasolacrimal duct, it opens into, that is food for thought. Look for that. So the maxillary sinus opens into the middle meatus at the level of. Now this particular question may confuse you, and I will clarify it in a while. So middle meatus, maxillary sinus opens into the middle meatus, but as I told you, middle meatus has got an ostiomeatal complex. Ostiomeatal complex is consisting of uncinate process, infundibulum, hiatus semilunaris, bulla ethmoidalis. So out of all these, where does it open? In the middle meatus. It opens into what we call as hiatus semilunaris. Now, multiple choice question means that we have to choose single best answer. This is the rationale. That there may be 2, 3, 4, even all 5 options may be correct, but we have to choose the single one. So which single one, which will be the most appropriate or the best, single best answer we have to choose. Remember that. So I will explain this infundibulum and hiatus semilunaris, because usually the students, they are confused between infundibulum and hiatus semilunaris. Hiatus semilunaris is present in, of course, it is present in middle meatus. Now, infundibulum, this is an air containing space that is bounded by the, this is the uncinate process where my cursor is moving medially, and on other side is the orbit. Here on other side is the orbit, because this is the lateral nasal wall and we are looking it from the inside of the nose, isn't it? From inside of the nose we are looking it. This is right nasal cavity we are sitting, and we are looking at the lateral nasal wall. So this is uncinate process medially. On other side, here will be the orbit. Between orbit and this lateral nasal wall is the lamina papyracea, and between these two is the infundibulum. So infundibulum It is bounded medially by the uncinate process, laterally on other side by the lamina preparatio, and behind is posterior is the bulla ethmoidalus. And what is bulla ethmoidalus? Nothing but this is the most consistent and constant ethmoid air cell, which is posteriorly present. In between is air containing space. Now the hiatus semilunaris, this yellow colored hiatus semilunaris, it is two-dimensional, defining the extreme medial opening of the infundibulum. So hiatus semilunaris is nothing but the most medial, and it is rather downward, below, lower part of the infundibulum. So this hiatus semilunaris is a semicircular shaped opening located on the lateral wall of the nasal cavity, and it is component of the osteomeatal complex, because osteomeatal complex, as I told you, consisting of this uncinate process, this infundibulum, hiatus semilunaris and bulla ethmoidalus, and this hiatus semilunaris is having the opening of the frontal, maxillary and anterior ethmoidal air cells. This is frontal sinus. So nasofrontal duct will be coming through the upper part of the infundibulum and ultimately draining into, while the maxillary sinus and anterior ethmoidal air cells, they will be opening in the hiatus semilunaris, which is nothing but the lower and medial part of the hiatus semilunaris. While middle ethmoidal air cells, they will be opening into the bulla ethmoidalus. So now going back to the previous question, that hiatus, even this is in the, of course this is a part of osteomeatal complex, so this is present in the middle meatus. Now coming to this, so the maxillary sinus opens into middle meatus at the level of hiatus semilunaris. If hiatus semilunaris is not the option, rest of four are the options, then we will choose infundibulum. So as I just mentioned, we have to go for the most appropriate or the best answer. And as I just described briefly the anatomy of the hiatus semilunaris and infundibulum, so now you have a very good idea of that if hiatus semilunaris is there in the option, then you have to go for hiatus semilunaris. Superior turbinate is confined to. So now again, just by describing it, just on this picture I will concentrate a bit and I will describe it. So this is the attachment of the inferior turbinate, which has been cut to show us the inferior meatus. Now the corresponding meatus is below and lateral to the turbinate above. Okay, so this projection of the inferior turbinate is just like that. Below and lateral to that is the inferior turbinate. Then this is the attachment of middle turbinate, which has been cut here. So, and this is the basal lamella of the middle turbinate. So this middle turbinate and inferior turbinate, between these two is middle meatus. So middle meatus is below and lateral to middle turbinate, and this is the attachment of the superior turbinate, and this is the superior meatus, which is below and lateral to superior turbinate, and actually it is in between superior and middle turbinate, and above and behind the superior turbinate is the sphenoethmoidal recess. Now you look for, this is the sphenoid sinus, so it is opening into the sphenoethmoidal recess. Here the posterior ethmoidal air cells, they will be draining into this superior meatus, while anterior group of paranasal sinuses, which includes the frontal sinus, maxillary sinus, anterior ethmoidal and middle ethmoidal air cells, which open into the middle meatus, while here the nasolacrimal duct from the orbit, it comes and it opens into the inferior meatus. Now if you look for the attachment of the turbinates, this inferior turbinate is attached to the whole length of the lateral nasal wall of the internal nose, while this middle turbinate, it is attached to the posterior 2/3. So when it is attached to the posterior 2/3, corresponding meatus will also be present in the posterior 2/3 of the lateral nasal wall, while superior turbinate is attached to the posterior 1/3 of the lateral nasal wall. So superior meatus is also confined to the posterior 1/3 of the nasal cavity. So just if you memorize this picture, whole of the lateral nasal wall anatomy is cleared. So keeping in mind this, we come to the next question, which is superior turbinate is confined to. So from this picture, we have seen that superior turbinate is confined to the posterior 1/3. So the answer here is posterior 1/3 of the lateral nasal wall. Middle meatus occupies the lateral wall in. So middle meatus will occupy the same which middle turbinate is occupying. And middle turbinate we just saw in the picture and discussed, it is attached to the posterior 2/3 of the lateral nasal wall. So middle meatus will also be confined to the posterior 2/3 of the lateral nasal wall. External nose is formed from. Now we know that it has got osteocartilaginous framework, external nose. Upper 1/3 is formed by the bony framework, while the lower 2/3 is formed by the cartilaginous framework. There are upper lateral cartilages which are paired. There are lower lateral cartilages which are paired. So there are two pairs of upper and lateral nasal cartilages. Then in between these there comes the upper part of the nasal septal cartilage. From the nasal septum, upper part is there. So nasal septal, that is quadrilateral cartilage, that is unpaired. So this is decided. Then there are some this sesamoid cartilages are lesser alar cartilages. They are two or more in number. So usually they are unpaired, these sesamoid cartilages. So they can be 3, they can be 2, they can be 4. So but usually they are unpaired cartilages. So in this question, 2 paired and 2 unpaired cartilages is the more close option. So that's why this will be the answer. During the inspiration, the main current of airflow in a nasal cavity is through inspiratory air current. It passes through the middle part of the nose between the turbinate and the corresponding part of the nasal septum. Very little air passes through the inferior meatus or the olfactory region of the nose. Therefore, weak odorous substances have to be sniffed before they can reach to the olfactory area. While during expiration, the air current follows the same course as during inspiration, but this entire current is not expelled directly through the nares because of the friction which is being offered to the expired air at the level of Lyman nasi, which converts it into eddy currents under the cover of inferior and middle turbinates, and thus the air goes into the meatus and the paranasal sinuses are ventilated during expiration. I will show you a picture for that as well. So during inspiration, the main current of airflow will be there in the middle part of the cavity in middle meatus in a parabolic lamellar flow. And this is the diagrammatic representation I just mentioned, that during inspiration, air is going in a lamellar flow between the middle part of the nose, while during expiration, when this air is being expelled out at Lyman nasi or nasal valve area or anterior end of the turbinates, there the friction, and due to that friction, this lamellar flow or air current, it is converted into eddies, and these eddy currents, then the expired air is being taken to the middle and inferior meatus, and that's why the sinuses are ventilated during expiration. Nasal cycle. The alternate opening and closing of each side of the nose is called nasal cycle, and this is physiological. This is due to the alternate congestion and decongestion, so that one nasal cavity is working more at a time as compared to the other nasal cavity. And Kessler was the first one who described this nasal cycle in 1895. And as I just mentioned, it is a rhythmic cyclical congestion and decongestion. And this nasal cycle, it varies every 2 to 4 hours, and it is characteristics of an individual. So from 2 to 4 hours, you can say. So in this question, the option which is more in favor of that goes into every 3 to 6 hours. Parosmia is, because one of the functions of the nose is olfaction. So anosmia is total loss of sense of smell, while hyposmia is the partial loss of sense of smell, and parosmia is perversion of the smell, which is seen in during the recovery phase of the patients who are having post-influenzal anosmia, or they are having intracranial tumors. Choana is, this is posterior nares. The word choana itself means posterior opening. So there is no anterior choana. There is anterior nares and posterior nares. Okay, and posterior nares is equal to choana. There is no terminology like anterior choana, and there is no terminology like posterior choana. Because if we say posterior choana, choana itself means posterior opening. So it means we are doubling the word posterior, posterior opening. And anterior choana means anterior posterior opening. No, that will be a wrong statement. So there is no anterior choana, there is no posterior choana, but choana is equal to what we call as posterior nares. Most common presentation of infant with bilateral choanal atresia. At birth, bilateral choanal atresia is an acute emergency, because by birth the infant is obligatory nasal breather. The child doesn't know how to breathe through the mouth at birth. He will learn mouth breathing later on. So at birth we have to diagnose it as early as possible, and we have to restore the airway in case of bilateral choanal atresia. So because the baby or the newborn infant will be having acute difficulty in breathing, a patient with bilateral choanal atresia. Septal cartilage is otherwise known as this upper lateral or lower lateral cartilages. They are the framework of the external nose. Same is with the lesser alar cartilage, which is present in the alley of the nose. It is also called as sesamoid cartilages. So the answer is quadrilateral cartilage. Nasal septal cartilage, because of its shape, which is quadrilateral, so it is also called as quadrilateral cartilage. This quadrilateral cartilage is attached to all except to the sphenoid. It is not attached to the sphenoid. Which of the following bones do not contribute the nasal septum? Nasal septum again is having an osseocartilaginous partition between the two halves of the nasal cavity. Osseous part consisting of the vomer and perpendicular plate of the ethmoid, and cartilaginous portion consisting of the septal cartilage. Then there is minor contributions, osseous contributions from other bones also. So here the answer is lacrimal bone. Lacrimal bone does not contribute. So in the picture it will be more clear. So this is nasal septum. Nasal septum has got three parts. One is columellar septum, which is consisting of the medial crura of the lower lateral cartilages along with skin folds. So this is what we call as columella. Behind the columella, there is no cartilage in between two mucopericardial flaps. So that's what we call as membranous septum. Then is behind that is the nasal septum proper. And this nasal septum proper is having a osteocartilaginous framework. Anteroinferiorly, it is formed by the nasal septal cartilage, which is also called as quadrilateral cartilage. And as you can see the shape of this bluish colored septal cartilage, it is quadrilateral. So that's why previous question they asked us what is the other name for septal cartilage. Then mainly posteriorly it is formed by the perpendicular plate of the ethmoid, and posteriorly it is formed by the vomer. So these are two main bony contributions, and minor contributions as you can see in the picture. This is rostrum of the sphenoid. Below is this is the crest of palatine bone, and this is the crest of maxilla. Anteriorly there is anterior nasal spine of the maxilla, and minor contributions are from the nasal spine of frontal bone and crest of the nasal bone. So here you can see the question was nasal septal cartilage is not attached to which bone. We can see this is not attached to the sphenoid bone because in between there is perpendicular plate of the ethmoid and the vomer. So septal cartilage is not directly attached to the sphenoid bone, but it is attached to the ethmoid, to the vomer, to the maxilla, to the frontal bone, and to the nasal bones. So just going back to the question. Ethmoid, it is attached with maxilla. Yes, maxillary crest is there. Crest of palatine bone is also there, and this sphenoid is also forming the contributing the nasal septum. Lacrimal bone is not contributing the nasal septum. This is about the nasal septum framework, and this was the question which I was just mentioning. Quadrilateral cartilage is attached to all except anterior nasal spine, that is from the maxilla, crest of maxilla, yes, perpendicular plate of the ethmoid, and vomer. But this sphenoid is not attached with the quadrilateral cartilage, but this sphenoid forms a minor contribution in the osseous framework of the nasal septum. Nasal septum, this has got contribution, but quadrilateral cartilage is not directly attached to the sphenoid. The bone which takes part in the formation of nasal septum is. So again, as I just mentioned before, that we have to go for the most appropriate answer. In the picture we have seen that there is nasal bone, minor contribution from the nasal bone, then there is minor contribution from the frontal bone, but perpendicular plate of the ethmoid forms one of the major contribution in the osseous framework of the nasal septum. So while lacrimal bone and the perpendicular plate of the palatine bone are not included in the framework of the nasal septum, but rest of the three bones, they are there, but main contribution, so the most appropriate answer for this question will be perpendicular plate of the ethmoid bone. Onodi and Haller cells are seen in relation to the Onodi and Haller cells. They are posterior and anterior ethmoidal air cells. Haller cells are anterior ethmoidal and Onodi cells are posterior ethmoidal. Haller cells are related to orbital floor, and these ethmoid cells, they extend into the roof of maxillary sinus ostium. These cells, they remain asymptomatic or they affect the maxillary sinus ventilation and drainage, resulting in recurrent or chronic maxillary sinusitis. They are present in 10% of the population. While Onodi cells, they are the most posterior ethmoidal air cells which lie in close association with optic nerve in the floor of the orbit. Onodi cells, they must be recognized during endoscopic sinus surgery on posterior ethmoid to avoid the optic nerve injury. So the appropriate answer will be optic nerve and floor of the orbit. And this is the CT scan. Coronal plane of nose and paranasal sinuses, and here you can see that this is the maxillary sinus. These are ethmoidal air cells, and here you can see in the floor of the orbit, just above the maxillary sinus, there is a cell. That arrow is indicating, and where this my laser pointer is there at the moment. So this is what we call as Haller cells. It is related with the orbital floor. If we go some more cuts posteriorly. So we have gone posteriorly, and here you can see that this is the sphenoid sinus. Okay, and sphenoid sinus, and on the side of that you can see this is what we call as onodicell, and just posterior to the onodicell is the optic nerve. So in close relation with the optic nerve, this posterior ethmoidal air cell, which we call as onodicell. Ciliary movement rate of nasal mucosa is, in mucociliary mechanism of the nasal mucosa, the cilia beat constantly at a speed of 5 to 10 millimeter per minute, and they are in contact with the serous layer of the mucus, which entraps the foreign bodies, allergens, and carry it to the nasopharynx. Beat frequency is 10 Hz and movements is metachronous. That is, all cilia at right angle to the direction of the flow are in the direction of the flow, while those in the direction of flow, they are slightly out of phase. So mucociliary clearance time is 5 to 20 minutes, and the pH of the mucous blanket of the nose is 7. The teeth related to the floor of the maxillary sinus. In an average adult maxillary sinus, the floor of the maxillary sinus is in relation with the second premolar and first molar. If sinus is a bit larger, then second molar can also be in relation, and even if it is larger than that in some individuals, even the third molar can also be in relation, and similarly the first premolar. But in an average adult maxillary sinus, the mostly or usually the second premolar and first molar are in relation with the antral floor. So with that, we come to the end of today's session. Thanks for watching, and please don't forget to subscribe the channel.